Hello, everyone. I hope that you are doing well on this wonderful Wellness Wednesday. It has been a minute since I've been on to do a live. Actually, I think January was the last time I did one, but I'm so excited to be back with you all today for this Mental Health Awareness Month. May, I like to say, is my absolute favorite month of the year for many, many different reasons. One, it's my birthday month. And so, of course, for that reason alone, it is the most amazing month of the year. But two, it is also Mental Health Awareness Month. And I just think God already knew it was the perfect setup that I was born during Mental Health Awareness Month. And so I'm so excited to be back here for our Mental Health Awareness series. We did one last year. It went amazingly well. And so I thought, what better way than to remix it and we bring it back and we do it again. Today, I am super, super, super excited because I have one of my good friends. I'm going to venture to call her my sister with me today. I don't know if you guys remember Dr. Angela Pobanz. And so before I bring her in, just let me know that you are with me. Hi, Doris. I see that you are with me today. Once you join in, please go ahead and just drop a comment. Let me know that you are on with us, and we are going to have a good conversation today. So make sure that you introduce yourself, drop a comment. Make sure that if you have any questions, drop them in the chat, and we are going to try to get to as much of it today as we possibly can. So I'm going to go ahead and bring in the Dr. Angela Pobanz. Dr. Angela, I'm going to call you that. I'm just going to call you Dr. Angela because I'm so proud of you and it's so amazing. Thank you for being here today. Can you just take a minute and just introduce yourself, let the people know what you do, what your specialty areas are, and just talk to us a little bit?
Absolutely, Chanel. Thank you so much for having me back this year. I felt the same that last year our conversation was amazing, but man, what a year we've had and how much more we can add to that conversation this year. So I am a licensed clinical mental health counselor, and I work in the state of Utah. I have my own business. It's called Thrivella, and I work exclusively with women, which is a good part of what we'll talk about today.
Absolutely. And so just a little bit of background. Angela and I actually went to, I was about to say undergrad. We did not go to undergrad together, although it feels like we probably did. We actually went to grad school together and was able to build an amazing relationship and just so blessed. And we'll talk about kind of our journey. That's a part of today's conversation, but just so blessed to have her to be a part of my life and to have amazing women who are also in this mental health fight right along with me. And so thank you for being here today. And so I'm just going to go ahead and jump right in. So just kind of a recap from last year. So last year, we started the conversation. We were talking about, we were in the midst of a pandemic, like we were right smack dab in the middle of the pandemic, and had a conversation about women's mental health, and then kind of brought that conversation also into how it impacts how women's mental health is affected, but specifically that of Black and minority communities. And we had that conversation. And since that conversation, we experienced a whirlwind of a year. There was so much that happened in 2020 since the last time we had that conversation. And I titled today's discussion between us Evolved Perspective, because one of the things that we both saw throughout the year is both of our perspective has evolved as it pertains to mental health, but also as it pertains to mental health care, as it pertains to treating minority communities. And so that's what I really want to talk today, have that conversation. Before we jump in, I do want to thank you, because this is a very real conversation. It's a raw conversation, and it's a brave conversation that a lot of people are uncomfortable unwilling to have. But I'm grateful that you're willing to have this conversation with me, because it's so necessary and it's so pivotal. And if we allow it to be, can also be unifying at the same time. And so how we kind of started is when we were in the midst of the pandemic last year, we were also dealing with, again, the killings of those Black men, also Black women in the Black community. And you invited me to a book club. You invited me to a book club. And I remember when you sent the invite, it sat in my inbox for a little while, and I didn't even respond. Because the book club was actually on the book White Fragility.
Yeah.
And I didn't respond. And if I'm honest, right, we said we're going to be real and raw.
Yeah.
If I'm honest, I looked through everyone who you had invited to be a part of it to see if there were any other Black people who were going to be a part of this book club, because
Right.
what I did not want to be was the only Black person that was going to be a part of this book club, just because, if I'm honest, the can of worms that I think that would have opened up, I didn't want to be the token Black girl, you know, and that was a part of it. And so it took me a minute to decide that I was going to do that. But I think you and I had talked, and after I talked, we decided to do it. So can you talk to us a little bit about why you decided to do that book club, and you chose the book, why you chose the book that you did?
Yes, absolutely. And I'm so glad that you did to your inbox, because it really ended up being transformative for all of us, and something I won't ever forget. But so the book club came about because it was actually right after Ahmaud Arbery was shot on February 23rd, 2020. And, you know, there was a kind of a signature walk that everybody was doing that was representative of his, maybe his birthday or something. Anyway, so I had done that with my son. And then shortly after, 2 months later, right, George Floyd was killed, May 25th. I obviously was just overwhelmed by how much we were seeing, how much video footage we were seeing. And it was undeniable, right? There was nothing controversial about what happened. It was very clear what had happened in both of those cases. And those aren't the only two cases, they're just recent ones. So after that happened, I think I reached out to you on the 30th. So it wasn't even 5 days later. I was really wrestling with my own feelings about that and wanting to understand more. And a friend of mine who actually was in the group, who was the other Black girl in the group, Britt Marie, recommended that book. She and her husband were reading it at the time. Now, he's a teacher at a private school, and I believe it was part of the school curriculum. So she recommended it. I picked it up, and I was like, well, you know, let's get a group of people together and let's dive in. It's going to be hard. I had no idea at that time how hard that was going to be. And it was something that I think all of us in the group look back on now and think that was a little bit like running a marathon, right? Because we stretched that out over a couple months. It was probably 2 or 3 months. We met every 2 weeks. Everybody was faithful to come every single time. And our discussions were 2 hours long sometimes.
Right.
So we discussed quite a lot, but that's how it came about.
Yeah. And I think I had briefly heard about the book prior to, but actually diving in and jumping into the book, you know, if I'm honest, when I first saw it, you know, it was kind of the mindset like, what is this book going to teach me? Like, I'm not going to really get anything out of this, you know. And so I struggled with it a little bit, but as I began to dig into the book, and I really liked, you know, like you said, the format you had set up, like we met every 2 weeks, and then there were very guided questions that kind of helped to lead us through our conversation. And it was a safe space. Or as I learned last year to say, instead of a safe space, it was a brave space.
Yes.
It was a brave space where everyone was able to be open and honest, speak your truth, and even make mistakes. And so I want to put a pin in, I want to emphasize that point. As we are talking about mental health and we're talking about serving minority communities and communities of color, I think it's important that we create these brave spaces where people can have real conversations and make mistakes and then grow from it. I think part of the issue that we face, especially as it pertains to minority mental health, is that the mistakes are being made real time. They're being made live in the midst of serving the people that we're supposed to be serving. And that is just not the right space to make those mistakes. And so it's important that as mental health professionals, I'm going to venture to say even as mental health advocates and even churches, because churches are really at the forefront of the mental health movement, if they choose to be. That's a whole nother conversation for a whole nother day. Need to create these communities and these spaces where we're able to have unifying conversations, have the hard conversations, conversations, make the mistakes, but then come together with each other and help each other to understand why that's a mistake, why we don't say things that way, why that perspective may be a clouded perspective, right? And for me, the book club was that space. It was a space of understanding, because going in, I was very apprehensive because I wasn't sure, if I'm honest, what the vibe of the room was going to be.
Yeah.
Like, I knew with you, I knew it was going to be great and I was going to be safe, but I didn't know the rest of the women of the group. And so I didn't know what the vibe was going to be, but the environment that was created was one of growth. Because even though I was one of the Black girls in the group, I learned a lot. But I was able to listen, and it also helped me to hear the perspective of my white counterparts and why they didn't necessarily see something that way, or why the struggle was a certain way. And so I think it's important, as we're having these mental health conversations, we have to do better to create these spaces of learning and spaces of growth before we go out there and do the work. Once you go out there to do the work, it's already too late.
Yeah, I kind of want to backtrack to something you said earlier about safe spaces and you coming into that space and what that felt like for you. I know I've expressed this to you personally, but I want to express it for other people to hear as well, which is, in a group like this, and there were only 5 people in our group. It was a small group, and I think that's part of what made it a brave space, right?
Mm-hmm.
But you and my friend Brett, and all of us, I think, but you two especially, showed just a tremendous amount of grace and compassion and patience for that process. So we needed that safety as well.
Mm-hmm.
That was something where when I said the wrong thing, I could receive feedback from you, because we love each other. We have a friendship, and I know where that is coming from in you.
Right.
And I know that you want me to succeed, and so you're coaching me. And that was the recipe for the group, to be safe for everybody.
Absolutely.
So even when we were having those really difficult conversations and we were feeling challenged, and even when, we could feel ourselves sweating a little bit through the conversation, we didn't shut down and we didn't lose touch of what the overall goal was.
Absolutely.
And a success. And so if that can be the example that small groups like this can set for others of what's possible, then it's worth any amount of what we go through to grow through that process.
Right. Right. And something that just came to mind, this conversation is so good on so many levels. What just came to mind is that you and I are both mental health professionals and got to be a part of that. Yeah. And I think that was a game changer. Now, I know, because I'm a therapist, oftentimes I get accused of, thinking that therapists are like the greatest thing since sliced bread, which we are, in my opinion. But I think a part of those brave spaces and those conversations, there was something about having us as mental health professionals there that I think added to that conversation. When we have conversations about race and we have those hard conversations, there is a mental health component that is added to this. And I think we were able to see different perspectives. We were able to hold different perspectives, but then also our ability to reframe. Right? Our ability to reframe certain conversations, our ability to hold space. I think all of that really made a difference. And I don't know, really interested in sharing your thoughts about how us being mental health professionals added to that. Because I remember we talked beforehand, and at first we were concerned, like, all right, we're not there to counsel anybody or whatever. But I really think that it added to the conversation. What are your thoughts on that?
Well, I know for me, an important part of being a therapist was kind of, and for you and I both really, but my intention was to read the room and kind of know when things are getting really raw, how to steer the conversation. So not that we're not still telling the truth, but so that we can maintain a counseling persona and be real at the same time. I never wanted there to be a point at which Chanel felt like she needed to take care of everybody's feelings in the room and not speak the truth, because that defeats the whole purpose of a group.
Right.
But being a counselor, we can take in other perspectives. We can have a great deal of empathy for people who are not us, who have different backgrounds, who are different colors. We have that ability because we have to. It's a job that we do and that we care about and that we feel passionate about.
Right.
So I think for us being in the group, and it was good that there was one on each side, so to speak. Does that make sense?
Mm-hmm.
You're talking across racial lines. It's good to have people who can communicate across that line respectfully, but
Right.
also without holding back. You got to tell the truth.
Exactly. Yeah. Yeah. That was actually, I'm going to say that was a God set up by design. You know, that, like you said, there was one of us on each side of the conversation. So I think that definitely added greater perspective, you know, to the book club. And I want to say this, I remember with that, you know, talking about these brave spaces, with that it was game changer for me in so many different ways, because I didn't realize how affected, how do I want to say this? I didn't realize how much my Blackness affected me in certain arenas until I actually did that book club. One of the things as I was reading through the book, some of that just seemed so normal to me. It just seems so commonplace to me to have to react a certain way, to be a certain way, even as a mental health professional, right? And as I serve white clients as well, having to be mindful of how I speak and how I act, or even microaggressions that will come from the couch, because that happens a lot too, right? And for me, even in workplaces, it was so commonplace that I didn't even realize how my Blackness was actually being called into question at certain times, because it was my lived reality and my lived experience. And one of the things, I do a workshop talking about generational trauma. And one of the aspects of that workshop that came to life for me when we did this book club is I talk about normalized trauma. And I talk about how a lot of times we experience trauma in our life, but because it is our lived experience, we don't even realize that it's actually a traumatic situation because it's lived experience. And one of the examples I usually give is, you know, growing up in the Bronx, New York. We lived across the street from a big park. It was called Echo Park. And we lived across the street from the big park, and it was crime ridden. And so literally every single night, and if my mom was on here, she would tell you to be true. Every single night we would hear fights and we would hear gunshots every single night. Now, that is not normal. That is not a normal occurrence where we should just hear gunshots and arguments and fight every single night. But it was my lived experience. And so for me, it was normal. And so when I moved to South Jersey, I struggled because it was so quiet. I was more scared because things were so quiet, and I was worried about somebody popping out at the bushes. Like, I was never concerned about, you know, if there were gunshots or whatever. Oh, I can handle that. I know to run and hide or whatever the case is. I was more scared about somebody creeping up on me and snatching me because it was so quiet. But the reality is that it was safe. I could not connect with safety because I had so much normalized trauma. And go ahead.
Well, I was going to say that that's so interesting. It reminds me of a conversation I had recently about trauma and working with, for me in particular, women of color, and bringing that into the conversation, because trauma is a lived experience for a lot of women of color. And we have to appreciate that across multiple levels, right? Being a woman alone has its own issues, right? And then being a woman of color is a whole other host of issues. And these microaggressions that you're talking about are something that are traumatizing. It's the underlying messages: you don't belong here, you're not one of us. And when you have heard that over and over and over again in your lifetime, you are traumatized by that. Whether you have regulated around it and adapted to it or not, you're traumatized by that. It changes your brain, and it changes the physical physiology of your body because of that trauma. So this safety thing that you're talking about is interesting, because you adapted so much to this trauma response and normalized that so much that when you didn't have to really be on high alert, you were more so.
Right.
But it speaks to how trauma doesn't always look like we think it's supposed to look. And so you have to be able to assess when trauma doesn't look like how someone tells you it's supposed to look, or a textbook tells you it's supposed to look. Those are the things when we're working with all women, but women of color in particular, we need to be asking those questions. And I'm going to reference Oprah here for a minute, just because she recently put out a book called What Happened to You? And I think that's such a great question, because it replaces the question, what's wrong with you?
Right.
And I think that's such a valid question for us to be asking people on our couches. What
Right.
happened to you? Tell me your
Right.
story. I'm not trying to pathologize you and slap a diagnostic label on you. Tell me your story. That's what
Right.
we would be talking about.
Right. And when you talk about storytelling and let me just say, I love having these conversations with you because this is completely off the script. This is none of what we plan to talk about, but it just flows so naturally. But when you just said, I lost my train of thought because I was just being extra. What was I saying? Remind me.
So we were talking about trauma and we were talking about
Right. I'm sorry. So this is live and in color, y'all. Live and in color. And so one of the things when you talked about that trauma informed perspective, because that's what that is, that question of, what happened to you versus what's wrong with you. And when you started talking about a storytelling, yes, thank you, Erica. Right. Storytelling. One of the other things I talk about in that workshop that I do on generational trauma is that storytelling is so ingrained in minority communities. Storytelling is major to who we are. It's major to our culture. It's major to our identity. So being able to bring storytelling into a healing environment, being able to bring storytelling into a therapeutic environment and even to therapy and counseling, it is so healing on so many levels. Because when you talk to Black people, when you talk to minorities, we always have a story. Right. That's how I learned my culture. That's how I learned my life. Like I find comfort in my story. I find comfort in the stories of my family. And so being able to pull that aspect into the healing aspect, right? And even as we talk about race-based relations and we have the conversations about that, just being able to open a space to tell your story. Yes. How you see your story, not trying to correct the story, not trying to change the narrative or any way, but giving people the space and the freedom to really tell their story. That is so freeing and it's so healing and it's so powerful, especially within the African American community, because that's one way that we connect and that we relate. And so if I was talking to a white mental health professional, I would definitely offer that as a suggestion. As you're working with clients of color, making sure that you pull in that storytelling aspect and you allow them to tell their story without interruption, without judgment, without trying to change the narrative, without questioning parts of their story, and allowing them to use that space to be able to tell their story. That is a way to definitely build allyship. Because if I can tell you my story and you're willing to accept my story, that means you accept me and you accept my history. Does that make sense?
Absolutely. And you know what, that reminds me of something else that I think we talked about earlier, and maybe even the last conversation that we had, but there's in therapy, there are acceptable approaches to therapy. There are evidence-based approaches to therapy. But what we forget when we're in a context where we need to fully understand someone's story is that applying these evidence-based treatments that were created by white men and tested on white people, and then we're expected to apply them to every scenario that walks in the door, that can be problematic. There does need to be some sort of narrative therapy, like you're talking about, the biggest thing being not arguing with the narrative. Why would you? Cognitive behavioral therapy is an amazing tool. It's one that I use a lot, but I am not going to hear a person's story and invalidate it with, well, maybe you should think differently about it. Right. Especially not right off the bat. Like if we want to work on problematic thoughts, that can happen down the line, but there needs to be some sort of trust that is built in the therapeutic relationship first before you apply any techniques, and not gauging the appropriateness of that technique based on whether or not it's evidence-based. That's important, but sometimes you have to assess in real life, and sometimes clinical work is a little bit of a separation from academic work. They don't always play well together. Like we can talk about theories and philosophies in school all we want, and they sound great, but when you have your feet on the floor in the counseling room, sometimes you have to figure it out in the moment, and it's not always about applying CBT.
Yeah, that is so good. I'm so glad that you said that, because Yeah, I'm so glad that you said that on so many levels, because for me, my experience in being a therapist over these last 10 years, I like to say I have an AD and a BC of being a therapist. And in my AD, I really tried to hold on to theory. I
Yeah.
really tried to hold on to textbook and do things exactly how I learned it. Now, here's what I'm not saying. I'm not saying that none of that is important. I'm not saying that none of that was helpful and that none of that was relevant. I'm not saying that at all. But what I've learned is when you're in the thick of working with somebody who's working through trauma and you're trying to handle that, there's not a textbook in the world that's going to give you what you need in order to help that person through their pain. There's not a textbook in the world that's going to show you how to hold space and when should I speak and when should I not speak and when it's time to challenge thoughts and when it's time to not. There's not a textbook or a technique in the world can show you that. And so there's something about, and I think that's why us doing our personal work, it's important that we do our personal work so that we can just learn as humans. I tell my clients all the time, we are two humans sitting here in this room.
Yeah.
That's it. We're two humans having a conversation. And guess what? Chanel don't have all the answers, but we're going to sit here and figure this thing out together. I may be there are times, and I may take a more radical approach, but there are times my clients will say something, I'll be like, girl, I'm just as shocked as you. But my clients appreciate that. I'll be looking at them like, girl, I'm confused too. I don't know what we going to do. But they appreciate that because it's very human. It's very real, and being okay with being human and real. And I feel like sometimes that's a lost art in the name of theory, if that makes sense.
And it can detract from the relationship. I mean, what you're describing is collaboration. Right? And I find that collaborative approaches are always the best. My clients call me Angela. I don't go by Dr. Pobanz. I don't want to go by that. I don't want there to be any kind of like perceived power dynamic, whether that's real or not, to be involved in the conversation. I want to be talking to people face to face, human to human, exactly what you're describing. And sometimes I'm flabbergasted. I'm gobsmacked too. Like you say something, I'm like, I don't know what I would do in that situation. Let's think about that for a minute. But making sure that the conversation stays level. Does that make sense?
Right. So let me ask you a question, right? As we're talking about mental health in minority communities, how does that translate for you as a white woman, as a white provider, if you're dealing with a person of color? How does that translate for you in being able to still be human, but meet them where they are and helping them to meet the need, and being mindful of microaggressions, being mindful of minimizing their experience? How does that play out for you?
Yeah, that's a great question. And that's a process, and it has been a massive part of my personal process this past year. And I know we're probably, if we have time, we're going to talk about allyship a little bit more. But I think as a white provider, it is really important for me to remember the first rule of therapy, which is to do no harm. And so as I work with women of color, which, I mean, if we're being totally transparent here, I'm in Utah, right? This state is almost 90% white. So I don't get the opportunity as much as I would like.
You mean it's not 100% white?
Well, it's some places it feels that way. It does. It feels that way. But anyway, so I don't get the opportunity as much as I would like, but I have worked with women of color here, and I've learned a couple of things. One is that I do need to be careful to listen and not exert any sort of like, oh, I have the answers to this kind of tone into the conversation. I might be a little more directive with my white clients. And it depends though. I still have to hear the story either way, but I'm not going to assume to know what a Black woman or a brown woman is telling me from their perspective, whether that's right or wrong. I don't think there's a sign of value to that. It's more just let me hear your issue, let me understand your perspective, and then if I can help, I will. But here's the critical thing. If I really feel like it's something that I can't connect to and do well with therapeutically, I will refer. I'll refer to someone so that I don't do harm. This is not a cop-out, and it's actually in our code of ethics. That if you are working with a client who is somehow beyond your scope of practice, that you need to be referring. Fortunately, there is a network of Black providers here in Utah that I've been able to track down and refer to, and that's been amazing. But I have a couple of clients that I've hung on to, and we do really well together, and they have told me, I like working with you because you're not Black. Which is interesting, right? It's so you never know. You have to kind of assess it as you're going through it, but you do have to be completely honest with yourself. Your ego and your pride can't get in the way. Your qualifications can't be part of the story of, well, I should be able to treat everyone. That's not true. I don't care who you are as a therapist. You can't treat everyone, and you're not qualified to.
Right.
So that's how I'm addressing it. It still is an ongoing, evolving skill set for me.
Right.
But I do feel like I have a much wider lens and a deeper sensitivity than I did even a year ago to that.
Yeah. I think that's so powerful when you bring up the point of do no harm, and learning when to refer. Like, it's okay. It's interesting because as therapists, we do understand the power of referring and do no harm. And we will do that for every other case and every other instance except for race. We will do it if I don't think that, okay, maybe you're dealing with sexual trauma that popped up. That's not an area of specialty. I have no problem with going ahead and referring. We'll do it if it's abuse or like whatever the situation is, except for as it pertains to race. And when I sit down and I think about that, like if we're talking about across the table, talking to a white provider, it makes me wonder, like it's almost, and this is going to be one of those controversial things that I say, but I'm okay with saying that it's a power issue. It's a power issue. It's an entitlement issue. If we won't refer because of race, and if I feel like I can't, I can't help this person or whatever the case is, it's almost like we try to hold on to that color blindness, that whole issue. Well, color doesn't make a difference. Race doesn't make a difference. But we have to, as providers, we are at the forefront of the social justice movement.
Yes.
And we have to remember that we're at the forefront of the social justice movement. And so even in that, that's a microaggression, not willing to acknowledge that race is the issue here and that race is playing a part and my client not getting the healing that they need because I'm choosing to take a colorblind standpoint.
That, we should clarify though, and make the point that if I'm referring, it really has to do with the issue, right? Like if you come to me and you have insomnia, I have CBT training. I can work on insomnia with you. Right? If you come to me and say the trauma that I experience based on my race, it really is impacting my daily functioning, right? And it's something that feels like it's beyond what I can help with, or that I might even inadvertently somehow add to that traumatic experience, I will refer. But 100% I'm going to refer. But it does matter what they're bringing to therapy. Like you have to consider what the presenting issue is. And even that could lead to somewhere else where you would need to refer. But sometimes it's very plain and simple. If you want to make more friends, like we can work on that. I don't have to refer you out for that because your skin color is different than mine.
Right. That's important too, right? And it's okay because I've actually had clients that worked with other providers while I was working with them because we did good work in certain areas, but they may have needed a sexual abuse specialist or something like that or whatever. So I think that that's important too. Maybe it's not an overall thing. Maybe it's just certain issues. Right? Maybe it's just certain issues, but I think that's where relationship comes in, and that's taking time to assess, and that's actually putting forth the effort to get to know the client that is sitting in front of you and how you can actually help them. That takes time, energy, and effort that you have to put in. So that's a really good point. So we titled today Evolve Perspective. Talk to us a little bit about how your perspective has evolved as a mental health provider and serving minority communities.
So it's been a big year, right? So starting with the book club and moving forward, I knew that this was just the beginning of a journey. And I knew the book club was not going to be it. And I knew that was not everything that I needed to know. Right. And I'm not even speaking specifically to mental health right now. That definitely is a piece of it. But I mean, as a person,
Right.
Knew that there would need to be more. So,
Right.
you know, the buzzword has been anti-racism, and that was something I started to dig into. So over the last year, I was listening to podcasts, I was reading books, watching YouTube videos, talking to people who actually can share with me what their experience is, instead of just listening to stereotypes or
Right.
other ideas that weren't personal. You and I connected every month this past year to talk, just to share our lives, just to be in others' lives, right? And that's a big piece of this puzzle that I think a lot of people overlook. You can learn all sorts of things about how to be an anti-racist and never make a difference, never do anything.
Wow.
So I compiled all the stuff that I learned, and I made like a short list. I call it the C's of change, like the letter C, the C's of change for racial equality. And I'm just going to shoot down the list, and I'm just going to share with you what I've learned. Okay. The first thing I learned was that we have to have curiosity, and that we have to make sure that we're going out and seeking information. So after George Floyd was killed, and we all watched it, there was no denying what happened to him. People took to the streets and they were protesting. And there was a decision that we had to make, and it was, do we watch and get curious about why people are so angry and upset about this? I mean, obviously we knew why, but the mass demonstrations, right?
Right.
We're curious about that so that we could see our blind spots, right? It was moving into an uncomfortable area and saying, where are my blind spots? And understanding that I can't and don't know everything. And that's what led to the book club, right? Was that curiosity factor. Then through the book club, there was this sense of conviction that built. And conviction was the fuel for everything else. Conviction alone is not enough, and curiosity is not enough. Conviction was the fuel, but I needed a vehicle, right, to do something. And that's where courage comes in. What you've been calling bravery, I've been calling courage. And the courage for me is courage to call things by their real names. And I think what has happened in this country is that we have all participated in this sort of gaslighting, where we have not really talked about the race issue in this country. We have been in denial. I think we've been a little revisionist with our history, a lot revisionist with our history. We've been invalidating, and we have not been talking about accurate depictions of history.
Right.
And so having the courage to call things by their real name was the next step for me, and to say that without apology, right? And to not worry about hurting my white friends' feelings. That was the next step. And connection was the next. So just making sure that you're getting to know communities that aren't yours, getting in and actually having one-on-one conversations, getting feedback on people's experiences was a big part of that. Racism is about dehumanizing people, right?
Right.
And it's about, I think the correction to that is finding commonalities. So rather than having this otherness factor that we're focused on, it's finding what makes us human together. So our conversations, which we would have had no problem having, book club or no, we talked about things that we have in common, right? And that's a first step, is seeing what does a community that you don't understand so well have in common with you. That's how you humanize a race situation. So that was the next step. And then creating opportunity. And you talked about this a lot in the book club in terms of making room at the table. You need room at the table. And I think that's misconstrued by some people to mean, I want to take your place at the table. And you're saying, no, I just want to sit, just make a place for me. Let me sit next to you at the table. Let me be part of this, create opportunities.
Right.
Counseling and coaching are a big part of allyship, because like you said, we're at the forefront of social justice movements. So it is up to us to make sure that we're having that impact with our clients, that we're hearing stories, and that we're having open conversations with clients who are struggling on either side, right? That we're making sure that people can have safe spaces to talk through these things. And then I think the last thing is just continuing to do the work, making sure that you don't get all riled up and make a bunch of social media posts and then you just stop and nothing else happens. That's not helpful. The sentiment is nice, but I think there's a tendency for white people to do a lot of value signaling and slacktivism when it comes to, and that's unfortunate, but I've seen it. People get excited for a minute and then it's like, oh, that was last week. And I'm like, no, this is a human rights issue that is ongoing.
Right.
And this is something that we need to be participating in every day.
Right. Right. Wow. Wow. That is such a powerful list. Like you said so many things, like I don't even think I could catch all of the nuggets. Well, first of all, this is like a book. You need to write this book.
I don't know if I'm the one to write the book, but maybe we can write it together.
It's a workshop or something, like just off of the Seeds of Change for Racial Equality. It's a workshop or something. A couple of things that really stood out for me is, like you said, not being afraid to call a thing a thing. And from my experience, what I find, especially with my white counterparts, are afraid to call a thing a thing. Are afraid of the word racism, and for good. And here's the thing, for good reason. I understand why that's a scary term, right? But being afraid to call a thing doesn't change my reality of having to live it. You know what I'm saying? And I think one of the things I say all the time is that when I name it, I can treat it. What goes unnamed is undiagnosable. It's untreatable. And part of our issue is because we're not explicit in naming what needs to be named, nothing is being treated. Nothing is being treated. Or when it is named, it's being named as a threat, as opposed to let's name it so we can make changes to it. And so I think that that is so powerful. And the other point that you talked about when you said creating opportunity, that's huge, because I think sometimes what happens is there's an expectation that, and I really don't want to use the word victim, so I'm not going to use that word, but the struggling party, let's say that the struggling party is expected to break down the door and to make the seat at the table for themselves. When the reality is, if you have the power, if you have the dominance, you have a responsibility of helping to open up the doorway, of helping to make sure that there's a seat at the table for me. Because then I have to fight the fight to get to the table. And then I have to fight the fight to try to keep myself there. When you have people who will naturally just listen to you because of who you are, whether we want to say because of the color of your skin, right? You have people who will naturally listen to you, and you have the ability to create another seat at the table. And so part of allyship, if you create the seat at the table for me, and then you help me to come to the table, then we can do the work. And now I'm not tired and I'm not frustrated because I had to work my way to kick down the door to get there. And I think that that's a part that's missing. And so for me, that is always huge. That is huge in so many ways, you know? And so I really appreciate this list. Like it was, I know we kind of had talked about it and I didn't really know what you were going to say, but I think it's so powerful because I think every C that you talked about definitely is a formula. And a formula that is, if it's followed, we can again create brave spaces, but then we can also start to do some work to change, because the reality is mental health is laden with racism.
Yes.
It is laden with racism. And I'm not even talking about from a theory standpoint. I'm talking about what communities where money is being poured into for certain communities for services. How services are being rendered. You know, one of the things, well, everybody doesn't know this yet, but I guess, you know, the cat's out the bag. I am studying right now to get my doctorate in the field. And one of the things that I really have been looking into and studying is how we talk about, we provide the services, but the services are not equitable and they're not quality. We provide the services just to say it's there. But it's hard to get into some of these mental health agencies. If we're honest, we're not hiring the top-notch providers to provide the services. Things are just kind of put together so we can say that we did it, but there's no real intention behind it. And so the services are not equitable within these communities. And so even that right there is laden. It shows how racism is at play. Because then if you go to some other communities, like you walk into the buildings, like it's an experience, right? As opposed to when you walk into urban communities and the mental health services that are provided.
Yeah, you bring up a good point about legitimate barriers, though, to people of color who seek services. And probably top of the list, maybe not top of the list, but up there is just lack of providers that look like you do, right?
There you go.
Someone who can relate to you, but there are legitimate financial barriers, and they're connected to a broken healthcare system that doesn't work for a lot of people.
Right.
I think until we address those issues also, and first, just like everything else, acknowledge first that it's a problem, and everyone's on board with that, and then actually making changes. But I would love to see more people of color interested in being therapists and counselors and police officers and getting in government. I would love to see more of that, more representation, more opportunity, more community, more examples.
Right.
That is my hope and my prayer.
Yeah. Later on in the month, my last interview series, I'll be meeting with one of a therapist colleague of mine, and we're going to be talking about representation and some of the work that he does. And he created, and I'll let him tell his story, but he created resources specifically for the African American community, resources that are already out there, but specifically touches and speaks to minority communities. And so we'll be having that conversation because I think it's so powerful. Like you said, in another transparent moment for me, you and I have talked a lot, and I've often stated to you, I feel myself definitely moving down a path where my niche is really in serving African American communities and serving Black communities. And I struggled with that because I really wanted to be the therapist for everybody. And I just wanted to be able to serve all. After the pandemic, the need and the passion just arises because it is necessary, like you said, to have providers that understand, who's not going to just throw all of these heavy diagnoses on me, who's not going to just, throw medication at me as the only solution. There is such a need, especially for Black men. And I'm so honored every time I have a Black man come to me for counseling. And I love counseling anybody, but I am so super extra honored when I get to counsel Black men. And to be a part of their change and their trend. It blows my mind every time. It blows my mind every single time, the honor that comes along with it. And so I've officially embraced my assignment. It took a while, but I've officially embraced my assignment. And I thank you for even having those conversations with me, because as I would kind of lay my heart out about that, you would always encourage me, but there's a need.
Yeah.
And you need to focus on where your heart and your passions is and fulfilling the need. And so I appreciate that. And so just to kind of round out the conversation, because we could be here all night. This could be a 4-hour conversation. Maybe we should do a podcast together.
We should do that. Yes. Yes. We're going to chat about that.
Let's talk about that. Oh, that would be so great. We're going to talk about that. I think that would be actually really amazing. But I want to kind of end the conversation on, we talked about, how your perspective has evolved, but I want to end the conversation on, what does allyship mean to you now? What were your thoughts on it prior? Right? If you even had thoughts on it, to be honest. And what does allyship mean for you now? And how can other white mental health providers be good allies in this fight, in serving, and maybe not directly serving, but be good allies in helping to push forth the conversations that need to be pushed forth to better serve African American and minority communities?
Yeah, that's a great question. You bring up a good point, is what did allyship mean to me a year ago? I don't know that was even on my radar, right? And I think you have probably heard a lot of white people say that. I wouldn't have called it that, but I think what I was doing was I had Black friends, right? So for me, it was like there's no problem. Like we're friends, we talk, like there's no issue. Then there was the book club. Right. And all of that blew up, right? And I'm so glad. I'm so grateful for that, because as you and I have talked about before, that deepened our friendship and made it so much more authentic and so much more than it ever could have been with me walking around with my cane and sunglasses on. So allyship for me is mostly embodied in this list. And the reason that I say that is because when I compiled this list, it wasn't something I came up with. It wasn't something that white people said needs to be allyship. These were all things that people in the Black community talked about. Whenever, of all the interviews and books that I read, whenever a white person said, what can white people do to be a good ally? These were the things they came up with.
Wow.
So I don't feel like it's my job to create that list, because I'm not qualified to create it. But I am, and that's why I said I can't write the book, but I can write it with you. I can co-author it with you. But these are the things, these are the ways that we need to show up. You need to connect with communities that aren't immediately around you. And you need to create, and not having it immediately around you is not an excuse. Not being Black is not an excuse. I can't say I don't know what it's like to be a person of color, so there's no point in me doing anything. That's a cop-out. And it's not okay. Things that I've done personally, I went out and found a group. So I joined a group of 8 women, and it is intentionally diverse. They put these groups together this way. And these are women that I'm doing life with. We are holding each other accountable for life goals, and we are sharing each other's lives and stories. I can't find that in my immediate environment here in Utah, right? But I didn't let that stop me. I went out and found a community. I talked to my friends who I've connected with over the years. You have to understand other people's perspective and be open to that, or you're going to fall victim to stereotypes and hate and racism.
Right.
Or worse, maybe you're indifferent and you don't care because it doesn't impact you and it's nowhere in your environment. So you feel like it's not important. I don't know which is worse. You would have to tell me, but I think they're both pretty egregious. So that's something that I've prioritized.
Yeah. Yeah. I think that's huge. You know, when you say that, we oftentimes think that we're not affected by something, or we're not a perpetrator on something because we're not faced with it every day.
Right.
You know, we think, oh no, that's not my reality. Well, how do you know that's not your reality when literally your reality is created to be the thing that you're comfortable with? And so what I hear you saying is, I made myself uncomfortable. I sought out opportunities to stretch myself. I sought out opportunities to be uncomfortable. Sought out opportunities where I wasn't able to just hide and what my reality is, but I couldn't hide, right? You know, and I know you'll understand this, but my ignorance was at the forefront. And the opportunities that I was seeking out to create for myself so that I can grow from it. And so many of us don't want our ignorance at the forefront. And so we stay in our pond. But if you always stay in your pond, you will never grow. A fish will only grow according to the tank that it is in. And if you stay in that little pond, you're going to stay a little fish forever, you know? And so I really appreciate even hearing you say that. Like, I sought out opportunities. I was intentional about it. It's not in my immediate living environment, but it doesn't mean that it's not out there and that I can't connect with it. And then growing from it.
Yes. And then it's not my responsibility. This is a human responsibility. Everybody's responsibility, because at the end of the day, no one's going to change racism on their own. It's not going to just be Black people. It's not going to just be white people. Everybody needs to be interacting in this way. And just one more thing before, I know we're running out of time, but when you said, you know, I'm putting myself in situations to be uncomfortable, there's truth to that. I mean, obviously there's truth to that, but I have gained so much more than I ever would have gained had I not done that, in terms of friendship, in terms of openness, of having my heart blown wide open. I would never had those experiences otherwise. So I just feel tremendous gratitude. The discomfort, who cares? Who cares?
Right.
Look at the reward.
Right. It's so powerful, it's just so powerful on so many levels because like you said, again, like for me, a wow moment was our friendship literally was rekindled over this issue.
Yeah.
And I'm so grateful for that. I'm grateful for that on so many different levels. And it just goes to show that when we facilitate appropriately and when we have the hard conversations, you don't know what beauty will be created out of the ashes.
Yes.
And the problem is that we don't take enough steps to take the next step to create and to see the beauty that's created out of the ashes. And so I appreciate you so much. It looks like Britt Marie just jumped on actually on Facebook. Thank you for joining. We're about to wrap up now, but you can always watch the replay later. But I appreciate you for having this conversation. And I think that podcast really needs to happen. Like that's really a thing.
Yeah.
That's really a thing. So we're going to talk about that. Y'all may be hearing, we'll find some creative name for the podcast, but I am grateful for this conversation. I'm grateful for you for being brave and having the conversation and putting yourself out there, because if we allow it, this can unify us in so many different ways. And so I hope for everyone who is watching live, or even if you're going to be watching a replay later, I hope that you get something out of this conversation. I hope that there are some actionable steps for you, or even that it brings up other questions and other conversations for you, that even within your respective areas of influence, that then you would find passion rekindled within yourself to go out and create and facilitate these safe spaces, these brave spaces, to have these conversations, so that when we go out to do the work, we can actually do the work because we've done what we had to do behind closed doors. Because truth of the matter is, there is work that has to be done behind closed doors before we go out and we do the public work, right? Behind closed doors is where we grow. And we have to make sure that we grow first so that we can do the work of helping the community. And so, Dr. Pobanz, I thank you again for joining me today, and just always, and just for being an amazing friend, and being on the front lines and doing this work. Again, another therapist thing, whatever, y'all can say what y'all want, but therapists are essential workers too. Yeah. And we were at the front lines. We were on the front lines during this entire pandemic in so many different ways. And so I thank you for being on the front lines during this pandemic and helping us with the work. But that is all that we have for you tonight. We thank you all for joining. Please make sure that you go ahead, like, and comment. I'll definitely go back later and read the comments, and we'll answer any questions. I'll ask Angela as well. Just go back and kind of see if there's any comments, and if you want to add any insight, please feel free to do so. Make sure you go ahead and you share the stream with your friend, and I will be back next week. We will continue our series. I'm so excited. Another therapist colleague of mine, whose name is Lori Ford, out of North Carolina, I believe she is. We're going to be having a conversation. She wrote a book called Fatherless Heart. I think that is going to be another powerful conversation. And she talks about her journey of growing up not having her dad in her life, and how that has informed her work as a therapist, and what her journey has been, and what healing looks like. And so that is such an issue, especially again, as we go about talking to communities of color, just looking at father figures and male figures in our lives. And so I'm so excited to have that conversation with her. So make sure that you tune in next week. We'll actually be at 6:30 next week. I'll make sure I send out reminders. Make sure that you tune in, and I will be back with you all soon. Love you guys. Thank you for joining Oasis family. Talk to you soon. Bye.